Hi, my name is Ken Tsai. I'm the Vice Chair of Research and Translational Pathology at Moffitt Cancer Center. I'm going to describe some work that we've been doing in collaboration with Verrica Pharmaceuticals on looking at the mechanism of action of a new drug, VP-315, or ruxitematide. VP-315 is actually patterned on endogenous peptides, which are cationic peptides. We actually have them on our skin. They actually are very interesting in the sense that it's thought that they exist to have some protection against microbes. So these peptides actually have the ability to puncture cell membranes of both bacteria as well as normal cells and cancer cells in this case. So this peptide has been called an oncolytic peptide, and the idea is that when locally introduced to cancer cells, they can actually puncture the cell membranes of cancer cells and release what are called danger signals to activate a local immune response. So what Verrica decided to do was to look at the efficacy of this drug in basal cell carcinomas. So basal cell carcinomas are the most common malignancy in humans, over 4 million cases diagnosed a year. And so in this phase 2 trial, patients were injected with VP-315 over a course of therapy. And what was found was that a majority of injected tumors actually had complete histologic clearance. In other words, when the tumors were ultimately surgically removed, there was no evidence of remaining tumor. And actually, very interestingly, there was also an abscopal-like effect, meaning the tumors that were not injected in the same patient also responded. So overall, 86% of tumors in patients had a decrease in size. So when we looked at the tissue to see what happened before and after injection, this is what we found. So the highlights are that cytotoxic T cells really increased in the tumor bed where the tumor had previously been, and in the non-tumor region that was correspondingly decreased. We saw similar results in CD20 positive B cells as well. And as a general rule, we actually saw a reduction in immunosuppressive T cells, including regulatory T cells, going down in the region around a tumor. So we think that this is a potentially very promising way to treat basal cell carcinomas and potentially other cancers without surgery. And I think this is particularly beneficial in individuals who have multiple lesions that might be in cosmetically sensitive areas, or potentially in an elderly population that doesn't necessarily want a surgery. Thanks so much.